Now, let's bring you today's perspective. And whilst many countries around the world are either dealing with the difficulties of coronavirus or trying to avoid it, it's important as well not to forget that it is far from the only virus claiming human lives. Just 2 weeks ago, a new outbreak of Ebola was declared in Guinea, with at least 6 deaths. The outbreak causing widespread concern across West Africa. Remember that 11,000 people died in the world's largest Ebola outbreak in Guinea, as it spread as well into neighbouring Liberia and Sierra Leone in the middle of the last decade. Well, as a mass vaccination programme for Ebola then swings into action, let's find out more about the problem and, of course, if there are lessons to be learned from both viruses. And joining us from Seattle is Director of Health Africa for the Bill and Melinda Gates Foundation, Dr. Paulin Basinga. He spent many years working in public health in Africa itself, notably in Nigeria and Rwanda. Thanks very much for being with us on the programme. First of all, then, let's talk about the Ebola outbreak. How worrying is it, do you think, and how can we be confident that it can be contained?
Thank you very much for having me. I think it's quite worrying to see another outbreak of Ebola in the midst of a current pandemic going on. But we are pretty optimistic because of the resilience of the people in those countries. They've learned a lot. The government, the systems, and the partners have learned a lot. They've been able to contain series of outbreaks in the past, and now we know exactly how to approach the disease, how to deploy people. And also one thing that they've done, which is amazingly very, very powerful, is to really bring communities together to make sure that the community understand the disease and they can also follow all the rules. And also the vaccines availability also will really help to tackle this. And we're pretty confident that, the government in the forefront will be able to tackle this as well.
We do still keep getting outbreaks, though, don't we? I mean, it's something that's never going to go away, do you think?
I think, the global community should continue to support the countries to really put in place, strong systems and understand how to control this in the past.
What about coronavirus? Obviously, it comes whilst that is also very prevalent. We have that good news of those first vaccines being handed out in Africa yesterday. But there are lots of accusations, aren't there, that richer countries, and inevitably France amongst them, really hogging the vaccines?
I think you're right. We are very excited to see the first vaccine arriving in Côte d'Ivoire, in Ghana, and vaccination starting this week, which is quite exciting. But this is 3 months after the vaccines have been available in richer countries. I think the world, the same way the world came together last year to really advance technology to find a vaccine for a disease that did not exist at the beginning of the year, I think that solidarity needs to continue in 2021, where really, vaccine can be made available for developing countries as well.
So do you think that solidarity hasn't been there up till this point?
I think there has been solidarity. I know one of the things that, a partnership that we've been engaged in, which is COVAX. For example, as the Gates Foundation, we've been part of the COVAX, which is an initiative that will really help bring, COVID-19 vaccine to make sure that they are available, and through Gavi and other partners. That is a very, very good solidarity, and many countries are contributing. But I think countries, especially developed countries, need to do more.
And let's talk about the two. I mean, on the one hand, we've got the Ebola vaccination programme. We've also got the coronavirus vaccination programme. Are there similarities between the two about the way those two programmes are coordinated, or are they basically completely different?
They are all outbreaks, but in different, amplitude, etc. And they're all coordinated by the government and the same partners. I think it's very important to get the population trust, the population coordination, etc. And the same kind of vaccines, but one is a new, and we don't know exactly, how to roll out COVID vaccine, etc. But I think the experience from Ebola, as you all know, that Ebola also learned a lot from the huge experience that countries had on, controlling polio, for example, is those same polio vaccinators, same microplans, and how to do outreaches, etc., were applied to Ebola, and they're going to be applied exactly for COVID vaccination as well.
So hopefully that experience, if you like, gained from dealing with Ebola will help in the fight against coronavirus then.
Oh, big time. Because in many countries, they've set up those emergency operation centers, and those are places where, government and partners and communities meet together and then strategize and plan for rollout of, high impact interventions. I think that will really help a lot.
Let's talk about your work as well at the Gates Foundation. I mean, the foundation's pledged, doesn't it, $1.75 billion to fight COVID-19. I mean, what are you able to do to try and to help and make sure that people get the vaccines that they need?
So, as you know, the foundation has been in existence for the past 20 years. And in those past 20 years, we've been able to, put in place different mechanisms and we've been able to really unleash those mechanisms to accelerate discovery of vaccines and also commit money in backing some treatment, such as the monoclonal antibodies, as well as development of, other vaccine candidate and also test, etc. So I think we've been also able, with those funds, to work very closely with the Africa CDC, with WHO, and other partners at the country level to really help, plan and provide decision support to the government that are really driving the response for COVID-19.
It sounds like what you're saying from that is that at the base of it all is basically the need for money. There's never enough of it, is there?
Yeah, definitely there is need for new money, given that the government also are dealing with essential services, because COVID-19 is one, but also they continue to be, persistent, rate of malaria and TB and HIV and, pneumonia, etc. Those diseases need, continued support, etc. Yeah.
Yeah, I was going to talk to you about those other. I mean, we mustn't forget those as well. We've talked about Ebola and coronavirus, but there's AIDS, there's tuberculosis, there's malaria. There's all these different things which obviously need tackling and continue tackling as well.
Oh, yeah, definitely. This is why we are really calling, along with WHO and other partners, to really continue to strengthen primary healthcare systems across countries, so that you have resilient system that can really, resist all the shocks that will be coming, so that we will ensure.
Finally, I mean, how optimistic are you? I mean, looking ahead at what could be to come, we've still got coronavirus to fight. I mean, there seems to be a sense, particularly here in Europe, perhaps, that we're over the hill. Things hopefully soon will start getting better as coronavirus vaccines are rolled out. I mean, do you think that is something that can apply to Africa as well, or do you think that Africa is a little bit behind still on the vaccine, so there could still be more major problems? Because so far Africa seems to have, perhaps excluding South Africa, largely escaped coronavirus.
I think the African countries will continue to fight. They've shown, impressive response. As you know, it was last February 14 when we got the first, February 14, 2020, when the first case of COVID came onto the continent, and many governments acted very, very quickly and put in place mechanisms to control and control the pandemic, etc. And they continue to work very hard, in partnership with WHO, the African Union. That they've also created many different mechanisms to try to really respond to the pandemic. Like the Africa Vaccine Acquisition Task Force that is complementary to COVAX at the same time. So, I think the response will pay off, but there is a continued effort that everybody needs to do to support those countries to make sure that their effort also pay off, because it's only when COVID will be controlled everywhere that COVID will go, because if not, we'll continue to have a challenge worldwide.
Great to talk to you today. Thanks very much for joining us there from Seattle, Paulin Basinga from the Bill and Melinda Gates Foundation. Thanks very much.
Thanks for having me.
The main headlines on the programme then: gunmen releasing the girls who were kidnapped from a boarding school in the northwest of Nigeria on Friday. The state governor saying on Twitter that all 279 girls have been freed. And France changing tack and saying people over 65 can now be vaccinated with the AstraZeneca vaccine. That, as new data shows, it's over 80% effective against severe cases of infection. And the Czech Republic records the highest per capita coronavirus infection rate in the world over the last week, 10 times that of neighbouring Germany.